Thank you. The state of Texas now reporting its first death associated with the Zika virus. Health officials say a baby girl died shortly after she was born with birth defects. Test results revealed the baby, in fact, had the Zika virus. The girl's mother was in El Salvador while she was pregnant. That's where doctors believe she actually became infected with Zika. There is no evidence that mosquitoes in Texas are transmitting the virus, but doctors do urge pregnant women there to certainly avoid mosquito bites. Joining us now to put this into perspective, talk about Zika in the U.S. because it is now here. We welcome back Dr. Ginger Cameron of Cedarville University. We always like to have you in to kind of put things into perspective because we have kind of crossed a line now. We now have Zika in Texas, certainly in Florida. So it's in the U.S. The game has changed somewhat.
Absolutely, and it is important to keep the numbers in mind of how many we know that we have, how many confirmed cases, in perspective of how many people we have in the United States. So it's still a pretty small number, but probably more than we know of.
The Texas case, very sad. It was fatality, yes. But again, the mother apparently picked it up in El Salvador. But different ball game in Florida. We now have mosquitoes carrying Zika confirmed to be in that kind of 1 mile radius area north of Miami. So that's, you know, the number bumped up to 21, I think I saw today, confirmed cases in Miami. So it is growing slowly, but it is growing.
And I think that will continue to grow because what we're seeing is that people, as we talked about previously, most people don't know they have it. So what's happening is the public health professionals are going to door to door testing people in those areas, and that's how they're discovering they even have it. So as they're able to go to more homes, we're probably going to see those numbers go up at least for a short while.
I'm hearing the governor down there and certainly Florida tourism officials, because of course they're a very popular tourist spot in the summertime, telling people it's okay, you know, Florida's safe, come visit us. They're trying to keep things in perspective.
And I think that's probably true. Again, remember these mosquitoes are very lazy, so they're not going to fly more than about 500 meters. So if you're staying outside of those zones, you have a better chance. The challenge comes in is that if somebody goes into those neighborhoods and then comes out, if they've been bitten and then they get bitten again, so it can spread very easily like that.
Let me ask you finally about a couple of new weapons in the fight. You mentioned the dunks, I think you said?
Yes.
And I also read today about genetically engineered mosquitoes. Tell me about those.
Yes, so dunks are little discs that you can purchase at Lowe's, Walmart, Amazon, pretty much anybody carries them. And they are relatively inexpensive that you can place into any standing water that you're not able to remove. You don't want to drink any water that you've put it in because it is a pesticide, but it'll kill off the mosquitoes in those areas. So if you have places where you can't get the water out, you can put a little dunk in.
Interesting.
The genetically modified mosquitoes is actually a very interesting topic, quite controversial, but what they've done is genetically altered the male mosquito who does not bite, and then he will, when he mates, transmit a genetic modification that will kill off the offspring, so basically preventing the females from reproducing.
And they're talking about releasing those possibly soon in the Florida Keys.
In the Florida Keys, yes.
So we'll track that story certainly as it evolves. But the latest on Zika, we appreciate Dr. Ginger Cameron from Cedarville joining us and bringing us up to date on a story that certainly is not going away.
No. Thank you very much.
Ginger, thank you so much. Katie?